refers to the addition of volume to the butt. And that can either be with an implant or fat. There are advantages and disadvantages to both, of course. Fat is preferential to a silicone implant, mainly because it's your own tissue, and two, it's more natural looking and feeling. However, the disadvantage is that one needs a lot of fat, and often women coming in with flat butts have no fat. The ideal patient for a butt implant, thus, is one who is generally thin, has no fat, and has a flat buttock and desires more projection. The ideal candidate for fat grafting, or a Brazilian butt lift as we call it, is someone who has enough fat to do such a thing. And usually it requires about 300 to 500 cc's per side, sometimes more, to really see a difference. Because when we put the fat into the body, we know we're going to lose some, and so we're going to overcorrect. Brazilian butt lift or butt augmentation with fat is generally combined with liposuction, naturally, because we need the fat anyway for the buttock. And these are most commonly the love handles or belly or the lower back to harvest the fat and then inject it with syringes into the buttock to resculpt it and give it more projection. It should be noted that the liposuction of the lower back is actually part of the creation of a beautiful buttock, because we get to slope the lower back, and often when there's fat deposits in the lower back, it obscures that takeoff from the lower back and that lordosis, as we call it. And lordosis is very attractive in particularly women who have a slope from the lower back to the butt. The butt implants we use are generally more firm and not quite as soft as the breast implants. If in the appropriate patient, if you put a butt implant in, and again, these are more firm than your soft silicone implants, it will look and feel pretty natural if there's enough padding. However, in the wrong patient that has very little tissue to start with, the implant may be more visible and palpable. The second thing is, of course, the scar. So implants that are placed through these incisions, if they don't heal well, they're tough to treat and can become, visible. The other thing to consider is infection rate. The breast is a much more clean area than the buttock when it comes to surgery. So unfortunately, butt augmentations with implants have a higher complication rate than breast augmentation, actually a much higher complication rate. One of the reasons is because we sit on our buttocks, right? And so they can move around and malposition's greater. Two is extrusion through, again, sitting and pressure, and also infection. It's not uncommon to remove butt implants from infection. It is uncommon, very uncommon, to remove breast implants from infection. So these are apples and oranges. They're not the same thing. And it's important for patients to understand who want a buttock augmentation with an implant that there is a significant risk to this. This risk is lessened, of course, with natural fat, which of course is preferable if you have fat to start with. It seems like big butts are in, so I would say that most women who have this procedure, either with fat or implants, tend to be very happy and are not shy about showing their results on Instagram and Facebook. I would say that butts are the new breasts in 2016.